Percutaneous repair or medical for secondary mitral regurgitation. Definition. Mitral regurgitation is a common heart disorder that causes blood to seep back through the mitral valve of the heart. Mitral regurgitation is a condition that occurs when the mitral valve leaks, when it should be closed during contraction of the heart muscle. Application in nursing. The mitral clip procedure is performed by the heart team, consists of an interventional cardiologist in the treatment of patients with mitral valve disease, a cardiac anesthesiologist, an echocardiograph, catheterization, nurse and industry supervisor, who are trained in the coordinated delivery and care of this complex therapy. After these procedures, these patients are prescribed dual antiplate therapy for a minimum of 6 months. Pros and cons. Advantage. The major advantage of a minimally invasive surgical open approach is a slightly shorter recovery time. Once surgery is complete, the valve function improves immediately. Disadvantage. One of the main obstacles is the existence of a functioning team of the heart. In addition, each center needs an expert echocardiograph with 2D and 3D imaging skill for optimal patient detection and intraprocedural guidance. Issues apply in Ecuador. According to the data collected by the National Institute of Statistics and Census of Ecuador, in 2014, a total of 4,430 deaths were reported due to ischemic heart disease. The 51.68% of the victims are men, while the remaining 48.32% are women, according to figures collected by the INEC. A total of 30% of the adult population between 40 and 69 years old. Conclusion. I'm a patient with several secondary mitral regurgitation. The rate of deaths or unplanned hospitalization for heart failure at 1 year did not differ significantly between patients who underwent percutaneous mitral valve repair in addition to receive medical therapy.
The blue flow filling the left atrium illustrates severe mitral regurgitation, or MR. The percutaneous mitral repair system consists of catheters and the MitraClip device. The catheter is introduced over a guide wire that has been placed using standard techniques. The dilator is used to gradually advance the guide into the left atrium. The guide wire and dilator are removed. The clip is gradually introduced into the left atrium. The clip is precisely positioned above the leak in the valve. The clip arms are opened in the left atrium for final positioning. Color ultrasound imaging identifies the severe MR illustrated here with blue flow. The clip is advanced into the left ventricle below the valve leaflets. The clip is retracted and closed to hold the leaflets together to reduce MR. If the MR reduction can be further improved, the leaflets are released and the clip re-advanced. Positioning adjustments may be made and the leaflets are grasped again to reduce MR. The double orifice opening allows blood to flow on both sides of the clip. The grasp and MR reduction are assessed before the clip is deployed. The catheters are then removed. Securely attached to both leaflets, the clip moves with the valve, allowing blood to flow through each opening. The mitral valve is repaired without open heart surgery. The MitraClip device is made of metal and covered with a polyester fabric to promote healing.